Hello, my name is Janine Overcash, and I am a clinical professor at Ohio State University College of Nursing. And today I'm going to be talking about training for older age. So what if aging isn't something that just happens to us? It is something we train for. Ida Keeling. At 67 years old, she began running. This was at a time when she was in a depression. She had lost 2 sons to violence. Her daughter, a track coach, did what daughters do and entered her in a 5K. That race changed her life. She became a competitive runner. And at 100 years old, she was the first woman in history to run the 100-meter dash. She went on all the talk shows. When asked what was her key to longevity and vitality, Ida said a healthy diet, being active in her community, daily exercise, which increases your functional status and independence, and a positive mental attitude, which heightens cognitive functioning. Cognitive functioning and functional status are the 2 things that I have studied during my clinical research in older women who have a diagnosis of breast cancer. So in 1995, I was hired by the Moffitt Cancer Center to start a senior adult oncology program, the first in the nation. It was modeled after a group from Catholic University in Rome, where my mentor came from. And we were to gather a group of interprofessional people, such as dietary, pharmacy, social work, medicine, nursing, PT. And we were going to conduct comprehensive geriatric assessment. And what that is, it's a battery of screening tools that look for things that often aren't caught on routine physical exam. The notion is, if you can catch things before they're big problems, people may endure chemotherapy or cancer treatment better. We found that about 20% of our folks that we screened positive for limitations, and most of them were functional status problems as well as cognitive impairment. So what is functional status? Functional status is the capacity to care for yourself on a basic level, such as bathing, dressing, eating, or on a more complex level, such as managing your money, your household. These things are things that keep us independent. Functional status is important to independence, and it's essential to cancer care. It is not chronological age that predicts cancer treatment outcomes or toxicity, or even is important in cancer treatment decisions. It is functional status. So what is cognitive function? Cognitive function is the mental processes to think, to learn, to remember. Cognitive function and functional status are related. When one becomes impaired, generally the other also follows. Impaired cognitive function can be the result of cancer treatment. Some folks experience a brain fog with chemotherapy that often dissipates. Or it can be non-cancer related. Impaired cognitive function can affect cancer treatment decisions. When someone has some cognitive impairment, are they able to care for themselves and manage their toxicities at home? And that factors into cancer treatment decisions. Age should not be the sole factor in considering cancer treatment decisions. It is functional status, cognitive function, and life expectancy. People who are 70 years old have a mean life expectancy of 15 years. And that's a lot of living, a lot of experiences, knowing different generations of your family. So how do we preserve functional status and cognitive function? We train. We put something in the tank so that when an insult comes, such as cancer, you can draw out of that tank, that reserve. That is resilience. So how do we maintain and develop that resilience? We train. Training to maintain cognitive function, diet. A diet high in ultra-processed foods has an increased risk of cognitive impairment. Sleep. Those who consistently get less than 4 hours of sleep or more than 10 hours of sleep a night tend to have an increased risk of cognitive impairment. 7 hours a night tends to be the magic number. Mental stimulation, reading, games, taking classes, playing music, all tend to increase cognitive function. Social engagement takes a lot of bandwidth to be social. And that is a positive feature in terms of cognitive function. But exercise is important. It tends to improve brain health across all age groups. Training to maintain functional status. Strength and flexibility can be improved in older age, even in people who have never exercised before. Lower extremity strength leads to increased balance, which leads to a reduced risk of falls. Staying active. Staying active is important. When we refer patients to physical therapy for lower extremity strength training, people do great during the physical therapy. However, once physical therapy is over and people do not do the exercises, then often people revert right back to where they were before physical therapy started. So staying active is important. Move it or lose it. CDC recommends 150 minutes a week of moderate intensity exercise. That's about 20 to 30 minutes a day. And that is a good investment in your future. Functional and cognitive training is not a magic bullet. People who are fit all their life and have worked out and done all the right things still get a diagnosis of cancer, still get sick. I'd like to tell you about Mindy. Mindy developed a breast cancer in her mid-60s. She's a retired school teacher, very fit all her life. She underwent treatment, did really well. However, 3 years later, it was found her cancer had returned. And once cancer returns, it's treatable, but it's not curable. And it accompanied a prognosis of 2 to 3 years. Well, Mindy kept a positive attitude, kept active as best she could, and she has exceeded her life expectancy. She has bought herself some time. Train for the life you want to live as you age, which may mean living with a serious illness such as cancer. Training to enhance cognitive or functional status is an investment in the future. You're building resilience. You are putting something in the tank should you need if you encounter a serious diagnosis. Start small, stay consistent, no matter what your current age. I'd have lived to be 106. Thank you.